You saw something so beautiful, you have a lump in your throat. As you bring your hand to your collarbone, you realize that this idiom is true. You do have a lump in your throat. It's located in the front of the neck, low, just above the collarbone. In fact, it's right by your thyroid, a butterfly-shaped gland that wraps around the trachea. Could this lump actually be your thyroid?
Studies have estimated that about 50% of 50 to 60-year-olds will have a thyroid nodule that is either palpable, found on physical exam, or seen on imaging study. Thyroid nodules are more common in women than in men. It is about 4 times more common in women than it is in men. The exact cause of thyroid nodule is unclear. However, there are several conditions that cause a thyroid nodule to form.
These conditions include an autoimmune thyroid disease, enlargement of the thyroid, which is called a goiter, iodine deficiency, although this is uncommon in the United States, thyroid adenoma, which is an overgrowth of benign thyroid tissue. Only about 5 to 6% of nodules are thyroid cancer.
So thyroid nodules, for the most part, are not symptomatic. They are usually benign. They usually do not cause symptoms unless they're large enough. So if a nodule is large enough, it may be visible on exam. Someone may go to, for instance, put on a necklace or button up their shirt, or look in the mirror and they may notice a swelling in the neck. Again, that's not symptomatic, but it's visible. In other instances, if it's large enough, you may have that compressive symptom, which is caused by compressing the trachea, leading to difficulty breathing, or compressing the esophagus, leading to difficulty swallowing. Also, in this day and age, lots of people are getting imaging for various conditions, and so thyroid nodules are picked up on imaging such as x-rays, dental x-rays, carotid studies, CT scans. Imaging that's done for a completely unrelated condition may found an incidental thyroid nodule. In some instances, a thyroid adenoma may overproduce thyroid hormone, and in that case, it leads to what's called hyperthyroidism, where there's excessive thyroid hormone. And so a patient may present with symptoms of hyperthyroidism, and these include palpitations, an irregular heartbeat, or a fast heartbeat, or they may feel jittery, shaky, they may have a muscle weakness, they may have unexplained weight reduction, and these patients on evaluation sometimes will be found to have a thyroid nodule as well.
Once a thyroid nodule is found, it needs to be evaluated by a specialist like an endocrinologist. This is done through a series of exams.
After the physical exam, we will perform laboratory functions. And these typically include looking at the TSH, which is a thyroid stimulating hormone that comes from the pituitary. That is what regulates the thyroid function. We look at the free T4 and the free T3, which comes from the thyroid gland. And we also look at thyroid antibodies. We want to know if there is an autoimmunity to the gland that is causing an underfunctioning of the thyroid or an overfunctioning of the thyroid. Then the patient is most often asked to obtain a thyroid ultrasound. So we look at all the features on the ultrasound, and then we decide, does the patient need to have a fine needle aspiration or a biopsy of that nodule? So that includes, again, the physical exam, the blood work, the ultrasound, possibly a fine needle aspiration, depending on the features of the thyroid nodule on the ultrasound. And often we also get a thyroid uptake and scan. This is a radioiodine study where radioactive iodine, an isotope, is given to the patient, and we determine the uptake within the thyroid nodules. So if a patient has a thyroid nodule and they have a hyperthyroid state, we will get the thyroid uptake and scan to determine if one of the nodule or multiple nodules are overfunctioning.
The nodule's features will decide which treatment option is most appropriate. Fortunately, over 90% of thyroid nodules are benign.
So if a nodule is completely benign, it's been biopsied and it's benign, or if it's small and did not warrant a biopsy, then it's monitored closely. This close monitoring includes ultrasound, usually annually, or if there's concern, it may be done at every 6 months. We also will evaluate the patient's function, again, annually or in 6 months, depending on what's going on.
If the thyroid is over or under functioning, then that needs to be addressed with surgery or medication. Surgery is often needed if the thyroid nodule is malignant or if it's large enough to cause compressive symptoms to the point that the patient has difficulty breathing or swallowing. So the next time you feel as if you have a lump in your throat, double check for a physical lump. You'll want to see your doctor if it's present during an ordinary moment, not just when you see something beautiful. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.